Things you need to know before becoming an inpatient virtual nurse. Number one, if you're rolling out a virtual nursing program on a unit, most of the time the nurses that are already working on the unit are not going to like the virtual nurse. They're going to feel threatened by the virtual nurse. With everything that's going on with technology, they're feeling like these nurses are here to take their jobs, and that's not it. But with that stigma, it's going to be a challenge to try to get things done sometime as the virtual nurse. Like the nurses on the unit are not going to mess with you at first. And I've done like 5 go lives across 5 different hospital systems, and it's like this almost every time. There's pushback, but it gets better at like the 3rd month when they see how much time the virtual nurse saves doing all the discharges and all the admissions on the unit. Yeah, that's when everything changes. But just be ready for that. You might get a cold shoulder and a side eye from the nurses, and that behavior will leak over into the patients, and they will give you a cold shoulder and a side eye. So just be ready for that. Number 2, as you're rounding and you're coming on the TV screen as the virtual nurse, yeah, your last name don't need to be on that TV screen. So I just recently found out that the patients can see your first name is cool, and your last name. As a virtual nurse, we don't really have name badges. We just kind of pop up on the screen, and when you pop up on the screen, your name, your first and your last name also. But your last name, like I said, does not need to be up there. And I say that because when I used to work at the bedside, a lot of the nurses would walk around with their name tags, and they would have like tape across their last name just because they had experiences with patients, looking them up and finding them and following them and things like that. And the same thing is true for virtual nursing. If those patients know your last name, they will look you up. And if you do not want them to know your last name, then you can take it off. And you could just ask your IT department to make sure that your last name is not displayed on the TV when you come up. I switched mine. Now when I come up on the screen, it just says Ava BSN RN. And last thing, when you are rounding on your patients as a virtual nurse, you need to make sure your patient's chest rises and falls. And I'm going to leave that at that. All right, y'all have a good day. Bye.